Myth 1. I don't have a cough or fever, so I don't have the virus. Symptoms are varied and not limited to coughs and fevers. The confusion around this likely came from coughs and fevers being the most common symptoms, but less common symptoms include myalgia, muscle pain, nausea, vomiting and diarrhea. What is most surprising is that a large number of patients may also lose their sense of smell and taste. This can occur in the absence of any other symptoms, meaning this discovery could be key in identifying very mild cases of coronavirus that would not otherwise be identified, according to the medical body and UK. Myth 2. I don't have any symptoms, so I don't have the virus. Most people who get sick from the virus will only show symptoms approximately 5 days after being infected, but it can take up to 15 days in some cases. One study found that during those initial 5 days, where people feel completely fine, is when the highest amount of viral shedding likely occurs, which is when infectious particles from the virus spread from one person to another. Young children might not be as vulnerable to the virus, but they may be an important source of transmission, as a study published in Nature Medicine and another study in China both found that children without symptoms were still highly infectious. Myth 3. Coronavirus is just like the flu. This myth was used to downplay the danger of the virus when it was first beginning to spread from Wuhan to Europe, along with rumors about the danger of the virus being blown out of proportion. It's now very easy to say, without a doubt, that one coronavirus is far more deadly than the flu, not just for older people, but for all people. 2. Coronavirus has a much higher hospitalization rate compared with the flu, 19% versus 2%. 3. The duration of hospitalization for coronavirus is approximately 10 days longer than the flu. 4. Transmission rates of coronavirus, how quickly the infection spreads, are much higher than the flu. 5. The flu has been around for over 100 years, so we built up an immunity to it. Despite this, thousands of people require flu vaccines every year because the influenza virus continuously mutates. In contrast, humans have no immunity to coronavirus, because it is a brand new type of virus, making the whole population far more vulnerable. 6. We don't have any known treatments or a vaccine for coronavirus yet. 7. Due to all of the above, the risk that coronavirus poses to humans is far greater than the common flu. Myth 4. I can only catch coronavirus directly from infected people. Unfortunately, coronavirus can live easily on a range of surfaces for several days. One peer-reviewed study found it could last on some surfaces, like plastic, for up to 9 days. However, the Centers for Disease Control and Prevention discovered that the virus survived on surfaces for 17 days, after infected passengers disembarked from a cruise ship. This is why disinfecting surfaces and washing your hands regularly is so important. Luckily, a simple alcohol-based disinfectant is enough to deactivate the virus. Myth 5. I'm young and have no health problems, so I'm not at risk. Although being young and not having any underlying health problems means you do have a lower risk, young and healthy people are still very much vulnerable to the virus. A review of over 500 U.S. patients found that 20% of those aged 20 to 44 were hospitalized due to serious complications, and 20% of deaths occurred in those aged between 20 to 64 years. Pneumonia is one of the most common causes for hospitalization in patients with coronavirus. Between 15 to 20 days of mechanical ventilation is typically required to assist breathing for those recovering from pneumonia. This means younger generations should seriously consider that simply contracting coronavirus could put a huge strain on an already overburdened healthcare system. Furthermore, the risk of death is not simply down to older age.